This is Coronavirus Explained. In this video, you'll find everything you need to know about COVID-19, aka coronavirus. Welcome to Curiosity TV, the place where you'll find so many of your questions answered for all of you curiosity addicts. We hope you like this new video we created especially for you. We know how it feels to need your curiosity satisfied about something. That's exactly why we're here. If you've read so much news and heard so much talk about coronavirus and you just want to know the basic facts and only the confirmed information about it, this is the video for you. Wait till you know about the most dangerous thing about coronavirus, the one thing that's creating all the craziness and all the fear across the world. Yes, it's not a very pleasant thing to witness a global pandemic and have to be confined to your home. But remember, if you're healthy and have a house, you're more privileged than thousands around the world. Maybe it's a time to reflect, to get whatever you've wanted to accomplish done, or just a break you've needed very much. Did you know that the virus turns your immune system against you? Let's start from the beginning. How does the virus enter your body? The way the virus works is that it goes into your body either through your mouth, nose, or eyes. It's carried in saliva droplets or discharged from the nose. One person carrying the virus, even if they don't show symptoms, can infect the people around them if they cough or sneeze. It is also transmitted if you touch an infected person or a surface they touched and then touch your face. So don't touch your face. After the virus enters the body, it comes into the intestines, the spleen, or the lungs, where it first invades organ-bordering cells. The coronavirus, not a living thing itself, enters a living cell and injects its DNA into the cell. The cell then is forced to produce copies of the DNA of the virus, which keeps multiplying. The next stage, the cell self-destructs. Corona particles are released and go to invade other cells. When this happens, the number of infected cells grows exponentially. A very dangerous thing happens to the body with this virus. It turns the immunity system against the body. When immune cells rush to the lungs to fight the virus, coronavirus manages to infect these cells. Way too many immune cells arrive and chaos happens. Both infected and healthy immune cells either kill themselves or are destroyed by other immune cells. At this point, it's either irreversible damage in critical cases, or in most cases, the immunity system manages to crush the virus and bring the body on the road to recovery. If you thought all the immunity system frenzy bit was crazy, wait till you learn about the most dangerous thing about corona in a bit. Sometimes we are deeply invested in something that we just cannot trace back where it started. I am sure all of you feel like this has been going on forever. Well, it began with one devastating announcement that shook the world. On December 29, 2019, China informed the rest of the world that it discovered a cluster of similar cases of pneumonia in Wuhan City. The disease was later identified as the new coronavirus. Then on January 13, 2020, coronavirus cases were discovered in Thailand. Later on, January 16th, more cases were found in Japan. This is when the virus started spreading outside of China. But wait, what does corona mean? What word does it sound like the most? You guessed it, crown. Corona means crown in Latin. The name was given to a group of viruses because of how their surface resembles a crown under an electron microscope. Now back to how this will go down in history. History, and each one of us will remember the following date. The new coronavirus, called Severe Acute Respiratory Syndrome-Related Coronavirus 2, abbreviated as SARS-CoV-2 or COVID-19, became a global pandemic in March 2020. Of course, you want to get a global picture of where this virus is at now. Unfortunately, we can't get the real picture. The problem is that the capacity of testing is still low in many countries, so even though we can track the numbers, we cannot have a full awareness of the spread of coronavirus. We can only know of confirmed cases. So this tracker you've been checking frantically gives you only the cases that have tested positive in laboratories. But why test for coronavirus? Shouldn't we just stay in? Testing for coronavirus is crucial if you show symptoms, but it allows you to receive medical care once you test positive. And if you know for sure you have it, you can then behave in a way that protects others from catching the virus. You can start self-isolating to avoid infecting the people around you. The World Health Organization recommends PCR tests to detect coronavirus. This means taking a swab from a patient's nose and throat to see if the genetic footprint of the virus can be found. But even that is not fully effective because there are still false negative test outcomes. That is, people can be infected but the test doesn't show it, and when they are tested again, they are found to be positive. This happens when patients are at an early stage or if they show no major respiratory symptoms. It could also be a problem with sample collection or just some technical issues. Bottom line, the real number of cases is not known for sure. But what we do know is that we can and must slow the spread of the virus, because coronavirus is much more serious than flu and it spreads much faster. When do you start getting worried? The top symptoms of the virus are fever, a dry cough, and fatigue. So if you show these, you might want to self-isolate, and if it gets worse, go get tested. 90% of people who are infected show symptoms of fever, 2/3 get a dry cough, and 40% get fatigue symptoms. Its incubation period is between 1 to 14 days, and the infection lasts 2 weeks on average. Descriptions of 44,415 cases in China show that 81% were mild cases. So no, you will not die for sure if you get the virus. But in critical cases, billions of cells die and the lungs protecting lining is gone. Alveoli, which are air sacs where breathing happens, get infected and respiration can fail. This is when patients can reach critical stages and need ventilators to survive. You might ask, why don't we just take medicine? There is currently no treatment or vaccine for coronavirus, but medical trials are ongoing. Some medications can help alleviate coronavirus symptoms, but nothing is shown to prevent or cure the disease. One observation is that older people and people who already have medical conditions like diabetes, cancer, high blood pressure, heart disease, or lung disease tend to develop serious illness more often than others. While most patients recover, it is necessary for people who show severe symptoms to get hospitalized. And this is why it is crucial to flatten the curve. Here comes the scariest scenario. The most dangerous thing about this pandemic, the reason that pushed governments to order lockdown and made everyone go on social media to tell people to stay in. The most horrible thing that could happen in a country would be if hospitals were forced to decide who gets treated and who does not. They basically get to choose who lives and who dies. Sounds cruel, doesn't it? Bear with us. It does not have to be this way. The idea is that a fast spread of virus would result in too many people getting infected at the same time, making the country's healthcare system unable to deal with the situation. That is why we must flatten the curve. Flattening the curve is about implementing early countermeasures so that the spread of coronavirus is slow. When too many people have coronavirus, there are no rooms or ventilators for everyone, so ugly decisions need to be made about who to treat and how many people die. So to understand the spread of coronavirus, it is important to look at not just how many deaths there are, but at the growth rate, how long it takes for the number of deaths to double. Countries that took extreme countermeasures have seen new daily deaths declining. In China and South Korea, at first, there was a fast increase in the number of cases, but when measures like complete lockdown were implemented, the speed of the spread of the pandemic fell. A slow pandemic means that people get the chance to be treated. And you have the power to change the world without moving from your bed. Imagine that just by staying home, you are having this immense impact where you are letting doctors and nurses do their job. Because the only thing we can do, since there is no vaccine yet, is to change our lifestyle to stop the contagion of the virus. The number one measure: wash your hands with soap so that the virus will not be able to infect you. And don't touch your face. That and social distancing. This means staying at home and not hugging or kissing anyone. That gives a chance for people who have coronavirus to be treated without an inflow of new cases. It is a global pandemic. The quarantines and flight suspensions ordered by government are no joke. They are in place to slow the pandemic, and you have your part to play in that. So do your part, stay safe, and stay home. You just learned all about coronavirus, where it started, and how the virus attacks the body. You know that the number of cases are only the cases you know are tested. Yes, most cases recover, but you still have a global responsibility to save lives. You must contribute to slowing the spread of the pandemic by staying home, not touching others, and washing your hands. You do not want to be even a tiny part of the reason why someone cannot find a bed in a hospital. We hope you learned something new in our video, Curiosity Addicts. Nothing like having your curiosity satisfied no matter the topic, especially if it's from trusted sources like the scientific online publication Our World in Data and, of course, the World Health Organization. If you enjoyed the video, you can subscribe to our channel Curiosity TV. Also, don't forget to turn on the notification bell. Leave a comment for us below and tell us what measures you've taken where you live and how you've been surviving quarantine. Even though we are sheltered in our houses, we have never been more united. So share your experience with us. Thank you.